reporting dozens of babies testing positive. Marcus Moore has the very latest for us from Dallas and that alarming development. Marcus, good morning.
Absolutely alarming, Whit. Good morning. You know, like so many parts of the country, hospitalizations are on the rise here, actually hitting record numbers here in Texas. And we're getting word of just how this virus is impacting our most precious loved ones, children.
This morning, California surpassing New York with the most cases of coronavirus. More than 409,000 confirmed since the pandemic started. As the infection rate rises around the country, hard-hit Florida becoming the current epicenter in the U.S. More than 9,000 new cases in the past 24 hours. Available ICU beds in the state declining as cases surge. 50 hospitals with no ICU beds. In Texas, hospitalizations hitting a new high with nearly 11,000, an increase of almost 300 in the past 24 hours.
I am concerned. I'm concerned for Texas.
The state seeing a surge in the number of babies testing positive for the virus. In North Texas, 433 babies testing positive in the 5 largest counties. Officials in Nueces County, which has the highest positivity rate in the state, 85 infants have tested positive for the virus since March, 60 of those in the last month. A 6-week-old infant died there in June. With COVID testing delays worsening, labs are struggling to keep pace.
One of the common denominators is that when you get surges like you're seeing now, it kind of overwhelms the system a bit.
And millions are waiting for a vaccine. In a congressional hearing Tuesday, executives from 5 pharmaceutical companies said they hope to have hundreds of millions of doses of affordable vaccine ready by early next year, insisting safety is not being sacrificed for a rapid release.
Speed is important, but we will not compromise careful scientific efficacy, quality, and above all, safety assessments as we evaluate our candidates, despite the urgency that we all truly feel.
This as an alarming new report from the CDC estimates that the number of people who were infected by COVID-19 in the first few months of the pandemic is likely to be 10 times higher than previously thought.
A lot of people have gotten infected from this virus, but were never diagnosed, partly because we didn't have very good testing, and partly because some people just have very mild disease. What this study shows is that this virus has probably infected 30 to 40 million Americans.
The study, which looked at antibody tests in 10 cities and states across the country from March to May, finding that in some places there were 6 to 24 times more infections than initially reported.
Back to the children, doctors are still unsure exactly what, if any, long-term medical effects they may experience after being infected. That, of course, is among the many questions researchers hope to answer as they try to stop the spread of this virus. Cecilia.
Okay, Marcus, thank you. And we're going to bring these questions right now to the director of the CDC, Dr. Robert Redfield. Good morning to you, sir. Thank you so much for joining us. Let's start with what we heard from President Trump just yesterday there in the White House. He says it is going to get worse before it gets better. That is a somber warning. I don't need to tell you that. Exactly how much worse are we talking about? What should Americans be prepared for?
Well, you know, I think it's important to realize that this is the greatest public health crisis that our nation's faced in more than a century. I will say, though, we're new in learning about this virus, so it is very hard to predict. Clearly, though, we have a significant upsurge of the outbreak now. What I'd like to focus on is what we can do to counterbalance that. And I've said before, we're not defenseless. We have powerful tools. Probably the most powerful tool that we have is a simple face mask. If all Americans would embrace that as part of their personal responsibility to confront this outbreak, we could actually have a very significant impact on the outbreak that we're seeing across the country in the next 4, 6, 8, 10, 12 weeks.
And you tweeted...
So that's the first thing that I would encourage you.
On those face masks, sir, you tweeted about them saying that they are part of your social responsibility. I want to ask you, so are seatbelts, so are laws against driving and drinking and driving. That's also part of social responsibility. Is a national mask mandate not imperative at this moment?
Well, I think it's really a question of how do you get the American people to embrace that social responsibility. Now, some governors have done it, you know, obviously with mandates. Other governors have done it through example. I think our key is just to let the American public know how important this is, and how important it is that we wear these masks, wash our hands, and really, if we did this simple acts, that we could, in fact, answer your first question. You say, what's the future hold over the next 4, 6, 8 weeks? I think largely it's dependent upon how we respond to our request to everyone to embrace their own personal social responsibility and become part of the solution by wearing masks, washing hands, and really thinking smartly about when they're in gatherings that they don't get in crowded situations.
But health experts like yourself have been warning about wearing masks for a long time now, and yet we still see people resistant to that. So why not just mandate this nationally and make people wear a mask if it will save as many lives as you're saying it will?
Yeah, I'm not sure that mandating makes. I think the issue is how to motivate all Americans to do that. It's obviously an independent decision that the individual governors are making. I think at this point, what we're trying to do is let people understand the most important public health measure that they can take to help change that question that you started that this could be getting worse before it gets better, is they could be part of making this get better before it gets worse by wearing a face covering, and that's what I'm going to continue to do. I think we have clear data now that face masks work, and we really now, the key is now how to get everybody to embrace them.
Returning to schools is at the forefront of the minds of so many parents right now. The CDC, you yourself have recommended social distancing in schools. Sir, how realistic is that really? Do you really expect first graders, kindergartners to stay 6 feet apart at lunch and on recess?
I think it's really important to get our schools open. As I've said, it's not public health versus opening the schools for the economy. It's public health versus public health. I think there really are a number of negative public health consequences that have happened to our K through 12s by having these schools closed. And so it's so important now to work together with school districts to figure out how they can take our guidelines and operationalize them in a practical way, and to do it in a way that's safe for those that are vulnerable, particularly the teachers and those children. I have a grandson with cystic fibrosis, but I do think it's critical. And one of the most important things is going to be the role of face masks and the role of social distancing in those classrooms.
And would you be comfortable with your school-aged grandchildren going back to school in the fall?
Absolutely. Absolutely. The only one that there may be some reservation is my grandson with cystic fibrosis, depending on how he can be accommodated in the school that he's in. But my other 10 grandchildren, of those, 8 of them are school age. I'm 100% that they can get back to school.
Dr. Redfield, thank you so much for joining us this morning. We appreciate your time.
Well, thank you very much. God bless.
Michael?
I have to say thank you now to those alleged vaccine spies. An explosive new indictment by the FBI claiming China directed 2 men to hack into U.S. drug companies working on a COVID-19 vaccine. ABC's Chief Justice Correspondent Pierre Thomas is in Washington with the story. Pierre, China's just the latest country